Hello, I'm Dr. Bang Ji-sung, the hair magician who protects your hair. It's a pleasure to be here. Some clinics aim to combine the benefits of incisional and non-incisional methods. I'll be frank. If the incisional method has some drawbacks and the non-incisional method has many benefits, as you know, newer and better things are more expensive. Being more expensive means you have to pay a much higher cost. And while some individuals can afford that and are well prepared for it, others might not be. So, what advice do I typically provide? I instruct them to first meet with a chief doctor at an incisional method clinic and inquire, "Chief doctor, how do you address the situation if the hair volume is insufficient?" Then the chief doctor would reluctantly say, "Well, we'd have to harvest more." If a doctor says that, I tell them, "I don't want a bigger scar, so if I don't have enough hair, I trust you to harvest a bit more using the non-incisional method." Then I tell them to choose that clinic. Why? Because it means they are prepared. But some clinics only advocate for the incisional method or only the non-incisional method. They just emphasize one side. In that case, since they are biased to one side, it can be disadvantageous for the patient. Clinics often speak favorably about their preferred method to secure the patient's surgery. They might force an explanation that the non-incisional method leads to sparser harvesting, resulting in lower density later on, which is worse. From the patient's perspective, the approach needs to vary with their scalp condition. So, incisional methods can certainly be good too. Approaching it from that perspective, neither method is absolutely superior. It truly depends on what the patient decides to prioritize. And if the outcome is what truly matters, it's now essential to consider that the quality of the transplanted hair could be superior. That's why clinics that focus on the incisional method say it's better, because they claim there's less damage during harvesting. Non-incisional clinics now have very little damage during harvesting. It has improved that much. The non-incisional method is like that. When I first saw it, it was at a level where I'd hesitate to recommend it for someone close to me who needed good results, though it was fine for experimental purposes. But now, there's no need to hesitate. If someone close to me were to have the surgery, I would do it with the non-incisional method, and it would definitely be better. Now, the method that leaves no trace of shaving is called the non-shaven method. It's a technique we often call the no-cut method, and with this, we harvest the hair as it is. After a day or two, even I can barely see the harvested area. The no-cut or non-shaven method is quite good, but it truly demands a high skill level. Why? Because the harvesting time for the surgery is doubled. That means harvesting alone can take 4 to 5 hours. Currently, it only takes 2 hours. Because it takes so long, there are many who say the no-cut method just takes a long time and gives bad results, but that's not the case. The no-cut method's greatest advantage is its enhanced selective harvesting. No matter what the scalp condition, whether there are scars, thin hair, or thick hair, we can absolutely perform harvesting. If the skill level is sufficient, we can always secure the necessary hair volume. If you ask me, that's what I personally tell people. For patients, if you really wish for the procedure to be unnoticeable and your scalp condition is not too severe, then partial shaving is acceptable. However, if you desire an even higher standard with absolutely no visible signs and a more perfected outcome through selective harvesting, then the no-cut method is undoubtedly the superior choice. That is precisely what I convey to them. Thank you very much for tuning in today. I look forward to seeing you all again. Thank you.